So dentistry's role. Well, as dentists, we cannot diagnose legally sleep apnea. That's under the realm, by state law, of the physicians. But we can screen, we can monitor, we can work hand in hand in assisting the physicians, the sleep physicians, with cases that are amenable to oral appliances. So we screen, we refer. And a lot of the physicians that I'm working with, the sleep physicians, they're very good about it. You know, they love having somebody who can take these cases that they didn't know what to do with because the guy came back in and says, I don't care what you do, I'm not going to wear that CPAP. Period end. The physician says, I don't know what to do. I don't have an alternative. So they're happy that there is an alternative and that there's somebody there to help them out. So screening and referral, provide and the oral appliance and monitor it. And monitoring is the key. I harp on it, I harp on it, I harp on it. Because without monitoring, we are going to be in problems down the road as things change. You know, and so what I do is with the home monitoring equipment, I can print off the report, I send it to the sleep physician. He has it in his file. He can take a look and say, hey, this is working, okay? And then the dentist monitors and treats potential side effects, any bite changes, anything like that, sore muscles. I really do believe that anybody who is going to be treating sleep breathing patients with oral appliances needs to be well versed in temporomandibular joint and muscle. If they're not going to know what to do when problems develop, and problems will develop. There's going to be something. I mean, I've had them too. You know, patient comes in, well, the muscles are sore. Well, I know what to do with them. And so it's not a problem. I can get them to the end result that I want them to be. It just takes a little longer to get there. Follow up, follow up, follow up. The guidelines, medical evaluation to proceed any appliance therapy. Now, a lot of my patients are ones who are on CPAP and they like them. They're getting along great with CPAP. But they may travel a lot and they don't like going through security. Or they may go camping a lot and they can't find a tree to plug it into, although they are making battery pack ones now that work. They work for about 6 hours and you got to take it and plug it in someplace again. So it's not totally without some issues. I have one patient, he does Civil War reenactments. And he says that, you know, they go out and they try and keep it as authentic as possible. They sleep out, they cook out, they do this, do that. And, you know, he says, shoot, when it's time to go to bed, I got to pack up my stuff and head into the closest town to the motel so I can plug in my CPAP unit. He says, I don't want to do that. So we're getting a lot of requests from people who are getting along okay with CPAP, but at certain times they want to have an oral appliance. Well, we were never sure quite how to answer that. Could we allow patients to bounce back and forth? And so the research now, again out of University of British Columbia, says yes, we can. There's no problem with having people wear CPAP while they're at home and oral appliances while they're camping. We're not putting them at risk. So that is a growing part of my practice right now as far as the sleep breathing is people who are saying, I'm getting along okay with the CPAP, but I just want to not have to take it with me all the time. Primary snoring, the oral appliances work well. Selected patients with obstructive sleep apnea, CPAP intolerance, and surgical contraindications. These are all cases where we would look at an oral appliance as a viable option. But I always do it in conjunction with the sleep physician. I want them to know what we're doing, okay? And they've been great. I mean, they've been great. We're getting better insurance reimbursement of oral appliances now because the sleep physician is writing a form that I have them, all they have to do is sign it saying that this is their recommendation because. And so the insurance companies for a while were struggling. It hit them so hard, you know, nobody knew what to do with it. I mean, prior to 2006, it wasn't even really an issue. And so now we have all these oral appliances and what should insurance cover and what shouldn't they cover. And we're fighting to say, well, if you cover CPAP at X%, then at least you should cover the oral appliance at X%. And they're starting to come around. I was talking to my business staff yesterday, and we're getting about 50% coverage at this point. Bree? Huh? Yeah, that's a good point, Bree. That's medical coverage. We don't submit this to dental, okay? Because this is a medical issue. It's not a dental issue. And appliance fitting by the dentist and follow-up by the dentist and information going to the physician.